Hello, I'm Dr. X. Today, I would like to talk about Dr. Eric Berg that why he is so wrong about vitamin D. Dr. Eric Berg, a popular online figure, asserts that 40 minutes of full-body summer sun exposure can produce up to 20,000 IU of vitamin D3. He argues this natural, high dose is non-toxic because the body self-regulates, halting excess production as needed, challenging fears that high-dose supplementation is dangerous. He often frames 20,000 IU as a potential therapeutic level for immune health and recommends pairing high-dose D3 supplements with vitamin K2 and magnesium for safety. This sounds logical and empowering. If the sun safely delivers massive amounts, why worry about supplements? However, Dr. Berg is wrong by treating sun exposure and oral supplementation as equivalent. While sun-derived vitamin D is indeed safe and self-limited, equating it to high-dose pills overlooks key physiological differences, risks of accumulation, and variability in real-world exposure. We'll explore this critically, first with simple logic and relatable examples. Second, through physiological and behavioral insights, and finally, with scientific theories, clinical data, and terminology. My aim is to give you accurate, balanced information to guide your decisions. Starting simple, with everyday logic and examples. Think of vitamin D production like brewing coffee. The sun is a controlled drip machine that stops when the pot is full, preventing overflow. Your skin makes vitamin D from UVB rays, but once enough pre-vitamin D3 forms, it converts to harmless byproducts like lumisterol and tachysterol, no overload. Studies from experts like Michael Hollick estimate fair-skinned people in peak summer midday can produce 10,000 to 25,000 IU from brief full-body exposure, so Dr. Berg's 20,000 IU in 40 minutes is in the ballpark for ideal conditions. Logically, you don't get vitamin D poisoning from beach days because the body caps it. But supplements are like force-pouring coffee, you bypass the auto-stop. Daily 20,000 IU pills can build up in fat stores, potentially causing hypercalcemia, too much calcium in blood, with symptoms like nausea, weakness, kidney strain, or heart rhythm issues. Example: patients inspired by online advice take megadoses without testing. Some end up with levels over 150 nanograms per milliliter and side effects, while sunbathers rarely do. Variables matter too: darker skin, northern latitudes like Detroit, winter, clouds, or sunscreen drastically cut production. Simple logic: sun is fantastic but unreliable year-round, supplements offer consistency but no built-in safety valve. Dr. Berg rightly praises sun but errs by implying high-dose pills are just as harmless. Now, let's deepen with physiology and behavior. Physiologically, cutaneous synthesis starts with 7-dehydrocholesterol in skin converting to pre-vitamin D3 via UVB, then to D3, and onward to 25-OH-D measured form, and active 1-25-OH-2D. The key safeguard: excess pre-vitamin D3 photoisomerizes to inert compounds, creating a natural ceiling, no toxicity from sun alone, as major sources like NIH and Mayo confirm. Oral D3 absorbs intestinally, enters circulation directly, stores in adipose tissue, and lacks this shutdown. Chronic high intake elevates 25-OH-D steadily, suppresses PTH, and risks toxicity when exceeding safe thresholds. Behaviorally, sun exposure is episodic. You instinctively shade when burning, and provides extras like nitric oxide for blood pressure or mood boosts. Supplements encourage routine megadosing without checks. Dr. Berg smartly suggests K2, for calcium direction to bones, and magnesium, cofactor, reducing some risks, but even with cofactors, prolonged excess causes issues. Case reports show toxicity at 10,000 to 50,000 IU daily over months. Real example: deficiency patients thrive on supervised 2,000 to 5,000 IU, but self-dosing high amounts, inspired by claims, leads to elevated calcium or stones. Sun wins for natural regulation and co-benefits, but isn't always feasible, especially in Michigan winters. Physiology shows pathways differ, behavior shows compliance and monitoring matter. Let's now dive into the more technical side of this, scientific theories and clinical details, so we can really understand why sun exposure and high-dose vitamin D supplements are not the same thing, even though they both raise your vitamin D levels. The body's built-in safety system for vitamin D from sunlight follows what's known as Hollick's model. Michael Hollick, one of the leading researchers in this field, described how the process works. When UVB rays hit your skin, they convert a precursor called 7-dehydrocholesterol into pre-vitamin D3. Then, if too much pre-vitamin D3 builds up, the excess is automatically converted into inactive compounds, things like lamisterol and tachysterol. This photodegradation step basically acts like a natural brake. It prevents your body from ever making dangerously high amounts in one session. Under ideal conditions. Fair skin, midday summer sun, a good portion of your body exposed, say 25 to 50% of your skin surface, the maximum you can produce in a single exposure is roughly 10,000 to 25,000 international units, or IU. That's the number you'll see in reviews by Hollick and in studies like the one by Terushkin and colleagues. Importantly, there are no documented cases of vitamin D toxicity purely from sun exposure. Your circulating 25-hydroxyvitamin D level, the main blood marker, almost never climbs into the toxic range because of this feedback loop. Now contrast that with taking vitamin D by mouth. Supplements deliver cholecalciferol directly into your digestive system, bypassing the skin's natural shut-off mechanism entirely. There is no automatic brake. The Institute of Medicine, the group that sets official nutrient guidelines, set the tolerable upper intake level at 4,000 IU per day for adults. That's the amount they consider safe long-term without special monitoring. Toxicity, meaning high blood calcium, hypercalcemia, high phosphate, suppressed parathyroid hormone, and potential kidney damage like nephrocalcinosis, typically shows up with chronic intakes above 10,000 to 40,000 IU per day, especially when blood levels of 25-OH climb above 150 to 200 nanograms per milliliter. Some analyses, including a well-known review by Hathcock and colleagues, suggest that most healthy adults can tolerate up to 10,000 IU per day long-term without obvious toxicity. But case reports still appear at higher doses, and individual sensitivity varies. When Dr. Berg talks about 20,000 IU from the sun being safe and natural, and then equates that to taking 20,000 IU in supplement form as a therapeutic dose, he's drawing on ideas similar to the Coimbra protocol in Brazil, where very high doses are used under close medical supervision for certain autoimmune conditions. The problem is that those high-dose approaches lack large, robust randomized controlled trials to prove long-term safety and efficacy for the general population. Current Endocrine Society guidelines are more conservative. They recommend 1,500 to 2,000 IU per day for maintenance in most adults, and up to 10,000 IU per day short-term only when correcting a documented deficiency, and even then, with regular blood monitoring. Here's the critical point: the body handles vitamin D very differently depending on the source. From the sun, production is gradual. The vitamin D3 is bound to vitamin D binding protein, DBP, right in the skin and enters the bloodstream slowly. It tends to have a more stable, longer-lasting effect in circulation. From a supplement, cholecalciferol is absorbed through the intestines, packaged into chylomicrons and lipoproteins, and can create quicker spikes in blood levels. A lot of it also gets stored in fat tissue, which means it can keep releasing slowly for weeks or months, potentially leading to accumulation if you take high doses every day. Meta-analyses comparing the two routes show that supplements usually raise blood 25-OH-D levels more predictably and reliably than sun exposure, because sun depends so heavily on variables. Your skin type, darker skin produces far less. Latitude, in Detroit, for example, meaningful UVB is basically unavailable from about October through March, time of day, cloud cover, sunscreen, clothing, and age. Sun does have unique advantages: no risk of toxicity from overproduction, plus extras like nitric oxide release for blood pressure, mood benefits, and better circadian rhythm alignment. But it's inconsistent and carries its own risk. Too much unprotected exposure increases skin cancer odds. Community critiques of Dr. Berg's videos often point out exactly these issues. He tends to downplay how much production varies by person and season, and he glosses over why official guidelines cap supplements at much lower levels, because oral intake is unregulated and can keep climbing without the skin's built-in limit. So in short, yes, the sun can safely deliver a large transient burst of vitamin D, up to tens of thousands of IU in one go. Because the body has evolved a clever self-regulation system. But taking that same number as a daily pill is a completely different story. No automatic shut-off, potential for buildup, and a higher risk window if you stay at high doses for months without blood tests. That's why I always say, get moderate, sensible sun when you can, test your levels, aim for 30 to 50 nanograms per milliliter, and supplement thoughtfully, usually 1,000 to 4,000 IU depending on your needs and location. Rather than chasing megadoses based on what the sun can theoretically do in perfect conditions. In conclusion, Dr. Berg is correct that sun exposure safely produces high transient vitamin D with built-in limits. It's natural and beneficial. But he's wrong to put supplementation on equal footing. Oral high doses lack regulation, accumulate, and carry toxicity risks without monitoring. Evidence supports moderate sun, when possible. Plus tested, moderate supplementation, 600 to 4,000 IU typical, higher if deficient and supervised. Get your 25-OH-D checked, aim 30 to 50 nanograms per milliliter, prioritize lifestyle, and consult pros over influencers. Vitamin D matters, but precision beats overgeneralization. Thanks for watching. Questions in the comments. Stay balanced and healthy.